Hey everyone, and welcome back to my channel. If you haven't seen me before, I am Safi and I am a nursing student in the UK, and I just wanted to do this video to sort of explain the reasons why you might want to become a nurse or whether nursing is for you. So yeah, let's get straight on into the video and I really hope you enjoy it. The first thing I wanted to talk about is putting others before yourself. So as a nursing student and when you qualify, you'll always be putting others before yourself. You need to have that sort of passion and that drive to put others' needs before your own, even though you need to look out for yourself as well and your own well-being and safety. You do need to put others first, and that's the main part of nursing. And the second most important thing is communication. So I say this in a lot of my nursing videos, but if you find communication quite hard with people, you will definitely need to improve it throughout your 3 years of training. And if you don't like communicating with other people, whether that's old people, young people, quite stern people, aggressive people, really kind people obviously as well, bubbly people, just all different personalities, you're going to have to communicate, whether that be colleagues, whether that be other staff, whether that be people below yourself like nursing assistants or domestics, whether that be people above yourself like consultants and doctors. You're going to have to communicate on a daily basis, 24 hours a day. And that's just something that is part of it, and there's nothing really getting away from not communicating, because it is part of the job and it is in the job descriptions that you need to have good interpersonal skills and interactions with people. So yeah, that is really high on the agenda for if you want to be a nurse. Really consider whether you like speaking to people, negotiating things, making decisions based on sort of best evidence and the best available care you can give to someone. So yeah, communication is a big part of nursing, and if you want to be a good nurse, you must have good communication skills. Thirdly, make sure you don't mind standing up for a lot of the day. Often you don't sit down for hours because you are just doing so many things and it's so busy on the ward, or there's just not enough seats at the nursing desk and so many different professionals are getting up, sitting down, going into patients, sitting down again, and there's technically not enough chairs for everyone to sit down, so you are stood a lot of the time. So make sure you take care of your feet. Honestly, I always like get rid of dry skin and moisturise and everything like that at least once a week, because it does take a toll being on your heels all the time. And make sure you have good shoes. It doesn't matter that you don't look the most glamorous or fashionable at work. Good shoes are really important, and if you don't have good shoes as a nurse, you're going to have sore aching feet, and it will affect sort of your feet in the future as well. And not looking after your feet, people don't realise, can actually affect like your posture and your back muscles and things. So standing in good footwear and taking care of your feet is really important. I'm just looking at my feet right now, I don't know why, I have socks on, but yeah, so just looking after your feet is a must for if you want to be a nurse. Fourthly, I would recommend just being totally organised. Knowing when you're going to work for your shifts is the most important thing, because if you arrive on like the wrong day, or you thought we were doing an early or late when you're doing a long day, it can just look really unprofessional and be very embarrassing if you ever do that. So you don't want to make those kind of mistakes. Just make sure that you're organised, you plan, and if you're not that type of person, get into the habit, because a good nurse plans and organises. They plan their patients, so they plan their life too. And planning takes some time initially, but if you go into a shift and plan your day when you've got 3 or 4 patients, especially, this is important, rather than 1 or 2, because you're going to have to manage your time better. You just need to prioritise what you're going to do first, what you're going to do next, and what is the most important. Meds are more important over chatting to a mum in a bed space for like an hour, whereas that might be lower on your agenda if they're a bit anxious. So it's sort of like prioritising care and working out what you need to do first, if you get what I mean. So I think that organisation and planning skills are really important in nursing, and if you don't have these, nursing might not be for you, because it is one of those things and you can't forget to do things. You can't forget to do the cares of someone or forget to give someone's IVs. It's a must rather than a need for the patient. It's also a need, but it is sort of a must, and a must be done during that time scale, that shift, to help them progress and help them get home, essentially. So yeah, I think just being really mindful of your planning and organisation skills is crucial to being a good nurse. I think I'm on the 5th sort of point now, and I'm not going to make this video really long-winded. I'm just going to do 1 or 2 more points because I want to keep it short and snappy, and I do ramble on. So the 5th one will be just making sure you're getting sleep, because if you don't get sleep and you're not the type of person that is really has a regimen of going to sleep before your shifts to get enough hours sleep to work through a 12-hour shift, then you're going to be tired, you're going to be achy, you're going to just want to sit down, and you're not going to be able to, especially if you're doing 2 sort of long days in a row, say Monday, Tuesday, then when you come home you're just going to be so unmotivated. Whereas if you actually get enough night's sleep, I often, even before setting off at 6:30 a.m. in the morning, at 5:15 I get up and do working out for half an hour, then shower, because that just makes me feel like I've started the day on a high, I'm motivated to get to work, and it just helps me feel better. And then when I get home 8, half 8, I don't have to worry about exercising that late. I can just eat my dinner and rest, because I think that it's really important, even on 12-hour shifts, to get that physical exercise, because all you're doing, I've started wearing my Fitbit to work, and I do 9,000, 10,000 steps a day, so it's not like you're not doing a lot of work and physical walking, but I'm just not doing the exercise I would usually do on my day off. So I really like to get up early and do that. But to do that, what I make sure is I go to bed at 9:30, 10, before 10. Otherwise I'm not getting enough sleep to get up at that 5:15 mark, am I? So I'm not being stupid and leaving it till sort of 11:30 p.m. to go to sleep. I'm getting that amount of sleep I require as an adult to progress through the day, and actually get a workout before work, which I know many people do not do, but I think it's really beneficial, and it really wakes you up jumping around at like 5:30 a.m. And I just feel so alive when I'm at work in the morning. And I'm not as sluggish, like when I don't work out before going on a 7:30 a.m. shift. I just feel like I need tea like at 9 a.m. and I'm still not awake at 9 a.m. and 8 till sort of 9 a.m, 10 a.m, when you're introducing yourself to patients, you want to feel alert and awake and know what you're doing and make your plan for the day and just be proactive. So it's really important to have enough sleep. That is essential. And if you think that your life doesn't fit with that kind of balance and lifestyle and doing shift work, then nursing might not be for you, because it is 12-hour shifts and you do have to manage time and manage your own well-being carefully in order to sort of be able to really manage your mental health and really manage how you're feeling to care for others. Because if you're not 100%, you're not going to put 100% into your work, and your patients are not going to be satisfied and have 100% feedback from you. And the last and final tip is just to make sure that you like the area of expertise you're going into. So whether that's children's, adults, mental health, learning disability, make sure you're interested in that. Not only that you like or enjoy looking after people of that age group, just make sure that you want to progress in that field further on, because there's not really any point doing the degree or going into nursing school doing children's nursing if you know that you want to not work with children in the future. You just want to do it to sort of learn. That's not really the point of a nursing degree. This is a vocation, so it's sort of like building you up for more, and you are sort of expected to stay in it for a few years. You might not do it in the future, but it's not something like a retail job where you can just drop out. You're on sort of the NMC register, you've got a pin, you have to pursue what you're doing. So the thing is, you really have to focus on what nursing vocation you want to go into. I was really torn between midwifery and nursing, mainly due to just I wanted to be able to just deliver a baby, but I thought nursing gives me so much more scope. It's 0 to 18, I still can look after newborns sometimes, but not like every day. I still get that adolescent interaction with a 17-year-old, 15-year-old, and I like that diversity, and I like having a 5-year-old than going into a 16-year-old. I prefer that. That's why I want to work on like a general ward. But everyone's completely different. I really love the HDU side of nursing as well, which is high dependency. That's something that is of interest to me. But I'm so glad I picked children's, because I feel that it just suits me perfectly, and I don't think any others would have fitted me quite as much. I am also really interested, I was interested in being speech and language therapist, but that's still incorporated into children's nursing, and I could, if I wanted to go back to uni and do a degree in that, then I can. But there's so many doors open that now I've done my nursing degree, my child nursing one, rather than midwifery, where all you're doing, all you are able to do is look after mothers and babies. If I wanted in children's nursing, I could go into the community or school nursing or health visiting. There's a lot of options. A lifetime nurse, which is respite care for palliative children who are dying. There's all sorts you can do in children's nursing. And I just wanted to explain that's the main reason I picked this type of degree. But whatever you choose, there is so many options, but some are more limited. For example, midwifery, I would say yes, you can progress, yes, you can be a neonatal nurse, but you can be a neonatal nurse with children's nursing too. But it's important to realise where that vocation leads to and where it stops and where you sort of can't branch off. So yeah, it's really important to consider that. And yeah, I really hope you have a lovely day, and I am ending the video now. And if you did, give a like and comment in the subscription for more nursing videos, because I'm really loving filming these for you guys, and I really hope you enjoyed. Bye guys.